Dr. George Benjamin is the executive director of the American Public Health Association, that is an advocacy group here in Washington. Doctor, thanks so much for joining us. We just had this report about Isaias making its way up the East Coast, including some of these COVID-19 hotspots. How do you think this storm might impact efforts to contain the virus?
Well, it's already resulted in the challenge of having to shut down their testing sites, which means that when they reopen in a few days, they'll be behind the curve in identifying who's infected and doing the contact tracing. So that's going to be a big problem. The second place, of course, is people that have to evacuate and go to shelters. Traditional shelters are not good because they're big congregate settings for physical distancing, wearing a mask, or washing your hands. So that's the second big challenge they're going to have.
Doctor, there was a recent study published in the Journal of the American Medical Association saying that children in particular, younger than 5, may harbor up to 100 times as much of the virus than in adults. It's quite disturbing. How might this factor into this debate among U.S. school districts about whether they should offer in-person learning as opposed to online?
Yeah, we're 30 days from going back to school, and all the schools are really being challenged. And as we know, we're beginning to know more about kids. We don't know what having that virus in their bodies means. It does not necessarily mean they're more infectious, but people are concerned about that. The big challenge here is, how do you go back to school safely? And we really haven't quite figured that out yet here in the United States.
Let's talk about big picture, Doctor. A report by Johns Hopkins University says, I quote, "Unlike many countries in the world, the United States is not currently on course to get control of this epidemic. It is time to reset." What will be needed in that reset? Will it need to be something dramatic, like a national shutdown?
We're going to have to increase the shutdown in many places. It may not be a national shutdown, but we're certainly going to have to come really kind of close to that. And the second thing we're going to have to do is rapidly ramp up our contact tracing and testing. Until we get adequate testing and contact tracing, even if we shut down, when we reopen again, we're going to be in the same place we were before.
And we're already into August, Doctor. Fall is just around the corner, and as you know, many experts are predicting this virus could surge even more. What do you think we can expect a few months from now?
I think the biggest challenge that we're going to have is that, of course, we're going to have influenza, which comes every year, and COVID. What I'm encouraging people to do, of course, is to rapidly build up our capacity to give flu shots so that we can sort that out from COVID cases. Also, we have a lot of kids in particular who have not had their childhood immunizations because they've been staying at home and not going to the doctor's office. I'm very much worried about COVID, but I'm also worried about things like measles, chickenpox, mumps. So we're going to have a massive effort to vaccinate folks, not just for influenza, but also the routine childhood immunizations. And we're also going to have to, once we get the once we get the COVID vaccine, prop our system so we can adequately give everyone that vaccine, even though that will not probably be until early next year.
And what is your final message for our viewers out there? What do you hope to impart on them?
Look, the prevention efforts work. Prevention works. Wear your mask, wash your hands, keep your distance. That's the best message I can give to anyone right now.
All right, Dr. George Benjamin with the American Public Health Association. Thank you so much for your time, Doctor.